in place. And this is done by passing a wire mesially and distally to each tooth and alternatingly apically and coronal to the arch bar. So in this case, I'm going to pass the wire on the distal of the first bicuspid, apical to the arch bar, and then the wire will be passed through the mesial of the tooth, coming out on the occlusal. Once I've done this, I take my wire twister and I tighten down the wire while pulling apically. And now my second wire is in place. I will continue doing this all the way across the arch until the arch bar is completely fixated to all the teeth. When you arrive at the anterior teeth, there's a technical matter that comes up, and that is how do you deal with the cingulum. If when you're placing your arch wires, the wire is not placed sufficiently beneath the undercut of the cingulum, as you tighten the wires down and as the wires loosen over time in the patient's mouth, the wire will start to ride over the cingulum and the arch bar will begin to loosen. So it's very important that when you place the wire initially, that it's sufficiently beneath the undercut of the cingulum so that later on, while the patient is in fixation, it does not ride up over the undercut. To prevent the wire from riding up over the cingulum, have an assistant simply hold the wire down on the palatal as you're tightening it down. Now that I've completed the placement of the maxillary arch bar, I'd like you to note a couple of things. First of all, if you look at the anterior teeth, you'll notice that the interdental wires are placed apical to the cingulum of the teeth. Another thing I'd like you to notice is that when I place the interdental wires around the distalmost teeth of the arch bar, my preference is to place the mesial aspect of the wire occlusal to the bar and the distal part of the pass apical to the bar. That way there's less of a tendency for the bar to slip off on the distalmost teeth in the fixation. The other thing I'd like you to notice is I've not yet cut the wires short at this point, and the reason for that is that while you're placing the wires, you can actually use these long wires as retraction for the lips. So once I've completed the maxillary arch bar placement, I'll grab the free end of each wire, and then using a wire cutter, I'll cut off the excess wire, leaving a tail of approximately 1 centimeter length. Being careful to always hold the free end of the wire with my hemostat so that the wire does not fly into the patient's eye or somewhere where you don't want it to go. Because the wires are made out of stainless steel, they have a tendency to stretch. And even between the short period of time between the initial placement of the wires and by the time you reach the point of cutting the wires short, they will have already stretched somewhat. So it's always a good idea to go back and give your wires an additional turn or two to make sure you have them down to their full tightness. And remember, when you're tightening, to always tighten in a clockwise direction and loosen in a counterclockwise direction. So here I'm always tightening clockwise. You notice I'm always pulling on the wires as I tighten also to apply traction to the wire. This is so that the wires do not curl up on themselves. Once you've cut the wires short, it's time to place your final twist into the wire where it's twisted and placed along the gingiva. So the way that I do this is by grabbing the wire at a 90-degree angle with a needle holder, pushing the wire directly against the gingiva and giving it a very hard, usually clockwise turn as you're pushing it against the gingiva. And then, after giving the wire a twist, simply take your wire twister and grab it and squeeze the wire and try to adapt it as best as you can against the gingiva. You should also take care to try to not place these hook sections of wire into the lug areas themselves, because that might make it more difficult to place your inter-arch fixation at a later point. Now we'll move on to the mandible, and just like we did in the maxilla, we'll take a wire and measure our arch length. And in this case, I'm going to go from the lower right first molar to the lower left second bicuspid. So here's my arch length, and using this length, I'll cut my arch bar to the appropriate length. So now I've cut my arch bar to conform to the length of the wire. We'll check it to see if I cut the bar to the correct length. And that seems fine to me. So when placing arch bars, it's always important to pay attention to the direction of the openings of the lugs on the arch bar. In general, the arch bar lug opening should always be directed apically. So in the case of the maxilla, the lugs open superiorly, and in the case of the mandible, the openings of the lugs should be facing downwards. So just as in the case of the maxilla, I'll place my first loop around the bicuspid tooth, which to me is the easiest tooth to place a wire around. Once I have my arch bar positioned exactly where I want it, I then take the single wire and tighten it down over the arch bar, locking it in place.